All right. Good morning, good afternoon, depending on where you are. I'm just going to give you guys a little bit of more time here to join in. If you've made it here today, you're here for the introduction to the Digital Assessment Library for Healthcare. So again, I'm just going to give maybe a few more seconds for people to join in. And thanks so much for taking the time to come here today to learn about this offering. I'm very excited to share what it's all about. And so we're going to go ahead and slowly get started, and people can join in as we begin. So, hello, everyone. Thank you for joining me today. My name is Samuel Rousseau. I am one of the assessment consultants here at Pearson. I'm actually located in Toronto, Ontario, up north in Canada. Over the last about 7 years or so, I've worked closely with various clinicians, healthcare providers, as well as school boards, bringing digital solutions into their practices. And so today, I'm really excited about introducing to you the Digital Assessment Library for Healthcare, or sometimes referred to as DAL Healthcare or DAL HC. And we'll explore how it can support your work. And so, without further ado, let's jump right into it. For those of you who don't know me or have not worked with me in the past, so my background is actually in psychology. And over the years, I myself have not only worked at Pearson, but have also done quite a bit of work in private clinics as well, providing assessment services to many different types of clients. And so I've definitely used a lot of Pearson tools, including our digital offering that we're going to be chatting about today. But what I have found in general is that clinicians who adopt these digital solutions into their practice, it really does help modernize the way that they work. And it inherently really helps them to be more efficient, more effective, and also give more time to essentially just focus in on your clients. The other thing that I'll mention too is that since the 2020 period, there's definitely been a noticeable shift in the way that many clinicians work. So increasingly, we have found that there's a lot more clinicians taking on a hybrid approach, which would combine traditional print assessments as well with our digital assessment tools. Um, in many in many respects too, I think a lot of clients or potential clients are also sort of looking for telepractice services. And so this DAL Healthcare offering that we have aims to really help in this particular scenario, as well as other scenarios that I'll talk about today. But as you can imagine, stepping into the world of telepractice creates both opportunities and challenges. And so hopefully with this offering, it will solve a lot of these challenges that you might be faced with. And so in terms of the rising demand, I mean, the wait lists for assessment services are definitely not getting shorter. So there's a lot of people sort of looking to get assessments done. And the other thing is setting up a new practice. So if you're a brand new clinician, or maybe you've decided to take that leap and go into private practice, setting up a new clinic is very expensive. Not only for, everything involved with opening the clinic, but also collecting all the tools that you need in order to provide your services. And again, as I mentioned before too, a lot of people are looking into into remote or telepractice, and a lot of clients are asking for it. And then the other thing too is when you open a new clinic, you may have a group practice where you're working with a couple other psychologists or speech and language pathologists. And everyone knows that there's a lot of difficulty with sharing one single item amongst a team. And so when we talk about the Digital Assessment Library for Healthcare, it really aims at answering sort of these challenges that might come up. Now, if you're joining us today, you're probably already aware of our two digital platforms, but if not, that's okay too. It can be a little bit confusing as they both start with the letter Q, but we have Q Global and Q Interactive, and they're both used together oftentimes. The likelihood that you're using Q Interactive and Q Global together is probably high. But for those of you who are new to our digital platforms or ecosystem, Q Global is our administration, scoring, and reporting platform. It houses over 100 Pearson assessments. If I'm being honest, a lot of the times Q Global is used to administer and score rating scales and questionnaires quite often. So things like the Basque, the Vineland, the MMPI, or to score assessments that aren't on Q Interactive. So we may have some performance-based assessments that aren't on Q Interactive. For example, the RAML 3, which a lot of people will use Q Global to score that assessment. The other neat thing about Q Global is it offers a resource library. And so if you've ever purchased a digital manual or STEM book, or if you've recently purchased the WIAT 4, you may have noticed that a lot of the features of the pieces to the WIAT 4 actually come on the digital resource library in Q Global. And so that's the other neat thing about Q Global. And then on the flip side, we've got Q Interactive. So Q Interactive would be our iPad-based administration system that allows you to do performance-based measures, things like the WIAT, the WISC, the WACE, administer them. And it is designed to be for live face-to-face administration. I have seen some people who have leveraged Q Interactive to do telepractice, but for the most part, I mean, it was designed to be a face-to-face administration system. It really replicates the traditional assessment experience while streamlining your scoring and eliminating a lot of these errors that you might get when you're doing this manually, and then, of course, providing real-time results as well. Together, these two platforms provide you with the freedom to choose the right digital workflow depending on if you're doing remote work, in-person work, or a blend of both. The other thing that I want to mention too is this video proctoring license, which is actually tied into Q Global. And I mention it today because you may not be aware that we had this, but also when we talk about the Dal Healthcare, there is the incorporation of this video proctoring license within one of the things that's offered in here. And so I wanted to quickly chat about this. So we integrated a service called QGVP, Q Global Video Proctoring. And what that does is it allows you to administer questionnaires, interview forms, or rating scales remotely over video without the need to ever leave Q Global platform. So you would simply send the assessment link to the examinee at an agreed time, begin your video session within your web browser. And what this does is it eliminates the need for a third-party platform like Zoom or Microsoft Teams. While administering this form, you can observe the test taking in real time. You can stay connected with your client afterwards to discuss or consult with the client. It's really just a seamless way to extend your practice into tele-assessment without compromising on security, compliance, or clinical confidence. So naturally, one of the first questions you may have is, okay, so what assessments are actually available on these two platforms? The list is very long. And so rather than post the list up here, I've got these two quick videos that kind of showcases the breadth of assessments that is available on both platforms. So on here on the left, you've got Q Global, and on the right, you've got Q Interactive. The video is just repeating over and over again, but essentially, when you subscribe to the Dal Healthcare subscription, you get access to the entire Q Global resource library, limited, of course, to your qualification levels. So if you are a SLP, you would have access to all language-based assessments. If you're a psychologist, you would have access to the entire library, and so on. Now, who does this benefit immediately? So we've identified essentially 4 different scenarios. So if you fall into one of these categories, I think the Dal Healthcare subscription would be a really good fit for you. And so the first option would be if you are a practitioner conducting remote assessment. So I mentioned this already a few times. So again, telepractice and the Dial Healthcare is going to fit very nicely together. The other scenario would be if you are a new private clinic or you're just starting up a new clinic and you need access to several assessment tools right away. This will actually be a very good option for you as well. Thirdly, if you are already a Q Global or Q Interactive user, I would say definitely check out the Dial Healthcare subscription when you get close to your renewal. Of course, if you've just renewed, you can always connect with us and we can discuss whether it would be an option to convert to the DAO model. Most of the time it is. And then the fourth option would be if you are a practitioner working in a group practice or small clinic. So again, one of the benefits of having the Dell Healthcare digital library is that all of your users that are subscribed to this will be able to access all of the manuals and stim books as much as they need wherever they are. And so in terms of what the key benefits are, the number one thing is that when subscribed to the digital assessment library, you will have unlimited access to and use of all manuals and stimulus books within Q Global. So this could be things like the SELF, the PPVT, the WAIST, the WIAT, all of the manuals that are typically restricted or need to be purchased, you will have access to it within your resource library in Q Global. Now, in addition to that, you will also receive a 7% discount on all Pearson clinical purchases. Now, the way that this was described to me is that the discount would be added at the subtotal level of your order. And so this is super unique because you can essentially order anything within, like put anything in your cart, and then the 7% discount will be applied to all of those items within your cart, with the exception of your renewal cost for the digital assessment library, or if you're just subscribing to that. But everything else, forms, report usages, subscriptions, response booklets, whatever you need will have that 7% discount applied to it. For Q Interactive, now we'll go over the three options for the digital assessment library, but regardless of what option you choose, you will get a discount on your Q Interactive subtests. And so that would be the 7% discount applied to subtests. So typically, if you are a prepay customer for Q Interactive, you were probably used to having to purchase a set number of subtests in order to get the tiered pricing. Now, with this option, you're not tied to those tiered pricing options. So you could purchase 50 subtests, 100 subtests, 500 subtests, however many subtest usages that you want, and you'll still get that discounted rate per subtest. In order to encourage customers to try to bulk their purchases, we are also offering free shipping 2 times per year. And so that would be between, so the month of June and also the month of November. And so any orders that you place within those 2 months, you will receive free shipping on those orders, in addition to the 7% discount on the actual items. And then here on the right, you'll see that another benefit here is the Q Global Video Proctoring license. And so this is incorporated within the Dial Healthcare service. It's in your Q Global account, regardless of if you decide to use it or not. But that will be available to all of your users as well if you subscribe to this model. And then lastly, you can convert your existing Q Global account and Q Interactive accounts. One of the benefits is that the user experience when you're subscribed to Dial Healthcare is pretty much the same that you're already used to. The major difference with Q Global would be that you would now have access to the entire resource library. And with Q Interactive, you would just have a different license type. and you will have some complimentary subtest usages in there as well. So I'll talk about the benefits next, because this is probably what you're all sort of wondering in terms of the pricing and what's included in the offering. So there are three options to choose from: the core license, the enhanced license, or the total license. Okay. So we'll start here at the core license. And so what this gives you is access to the entire resource library. So this is perfect for users who are mainly just doing telepractice and need access to digital manuals and stim books. And so for that, it's a cost of 475 US dollars per year per user. And in Canada, it's $570 Canadian per year per user. Along with all the other benefits that we just talked about. So your 7% discount on all orders, your free shipping a couple times a year, your video proctoring license. So you'll get all of those benefits included, as well as access to the library. Now, if you're looking for a little more, or you want to incorporate both platforms, Q Global and Q Interactive, the next option is the Enhance license. So you would get all the key benefits that we just talked about. And this is great for any light Q Interactive users, or especially SLPs who might not need access to the entire library. And so what you would get on top of all the benefits that we talked about would be a Q Interactive license, as well as 250 complimentary subtests added to your account. So for that, it's $975 per year per user, or in Canada, it would be $1,170 per year per user. And if you are a heavy Q Interactive user or need access to the entire Q Interactive library, then you can jump or upgrade to the total license option. And what this does is it gives you all the key benefits that we just talked about. It's great for psychologists or heavy Q Interactive users. And it will give you a Q Interactive Max license, which just means that you'll have access to the entire Q Interactive library, as well as 500 complimentary subtests added to your account. So for this, it's $1,575 per year per user, or in Canada, $1,890 per year per user. So what does that actually look like in practice? So I've done a comparison chart here just for you. So here we've got the core license, the enhanced license, and the total license. So where you will see the most savings is especially for those who buy or have purchased digital manuals in the past or plan to do it in the future. So what I've done here is I've marked the average cost of a stim book or manual. So we'll just say that it's around $448. And you can see here that if you were to purchase these items a la carte, you would spend that $448. So for the core license, you don't have access to Q Interactive. Our Q Global Video Proctor license is $199. And then the savings that you would get on a $500 order plus your free shipping is approximately $65. So in total, you will have spent around $712. But of course, with the Dial Healthcare, you would have only spent $475 and would have had all of these included, as well as the entire assessment library or the resource library, not marked here. Now, another option would be your enhanced license. So similar idea here. So if you purchase a manual or two, so you're spending $448, this time you want to add a Q Interactive license. So for our light or SLP license or academic license, it's a $200 charge. Your subtests, so 250 subtests is roughly $475. Your QGVP license, $199. Your savings on $500 would be $65. So in total, you would have spent $1,387 as opposed to the Dial Healthcare, which gives you the exact same thing that I just mentioned here, but for $975. And then finally, the total license. So if you're a heavy Q Interactive user or a psychologist who needs access to the entire library, again, you may purchase a manual. A license for Q Interactive is $300. Your subtest would be around $950. Your QGVP license, $199, $65 of savings. So a total you would have spent $1,962, whereas with the Dal healthcare model, you would have spent only $1,575. Okay, so that was a lot of talking, a lot of numbers. And so what I wanted to do next is actually give you a more practical example. And so here we have a made up clinic. So I've decided I'm going to open my own clinic called Russo Assessment Services, Inc. So we're starting fresh. We've got 3 independent psychologists working together. We prefer going digital if possible, reducing that reducing the use of paper. And then we also are thinking about expanding to telepractice, but we've been very hesitant in the past because of costs. And also we know that with telepractice, you tend to have to utilize multiple different platforms. It's just very complicated. So we've hesitated, right? And then also we're tired of sharing kits. We've got sort of one kit being shared by all 3 psychologists. And just the other day, we had 3 assessments booked at the same time, and we were all fighting against the kit. It was just not a great time. And so we've decided to look into the Dal healthcare model, and our wish list is the WAIS 5, the Y4, the Beck depression inventory, the Beck anxiety inventory, and the Brown executive functions and attention scales. So simple sort of toolkit for this particular example here. So I've looked at the numbers, and if I add all of the materials that I would need in order to access the manuals and the stimulus books, I would be spending $3,079. My QNeractive license would be $300. My QNeractive subtest would equate to $2,475. My savings on 1,000 additional subtests would be approximately $173.25. My QGVP license is $199. And then the savings that I would have on an additional order of $1,000 with the free shipping is $130. So in total, as a new clinic, I would have spent approximately $6,356. And this is just for one license. I just noticed this, that you may actually need 3 licenses if if your clinic has 3 psychologists. So you probably would have spent a little bit more than this. Whereas with the Dal healthcare subscription model for 3 users would cost me only $4,725. And I would have access to the WAIS and the Wyatt on QNeractive, along with all the other amazing tools that we have on QNeractive, like the DCAS Advance, the PPVT, the EVT, the R bands, and as well as my Beck inventories and the Brown executive function and attention scales. So hopefully that was helpful. What I'm going to do now, and let me just take a look at the time. So we're about 25 minutes in. So we will probably end in about 5 minutes or so. So if you haven't done so already, please post any questions that you may have in the Q&A box, not the chat box. I do have a colleague of mine who is monitoring the Q&A box who will answer questions either on the spot or will take the questions at the end of this webinar. So without further ado, some of the top frequently asked questions that we have gotten so far. Number 1 is, can I convert my existing QNeractive and QGlobal account to the Dal healthcare model? And the answer is absolutely yes, you can. Your existing accounts can be converted and any current inventory will remain in your account. So you will continue to have access to all of your inventory that you've already purchased, as well as all your client data. Another question that we've gotten is, do QNeractive starter kits come with the Dal HC license? So this is actually a US only offering that we have. And so if you're new to QNeractive, you get these starter kits. And so the answer is yes, you definitely get those starter kits, even if you decide I'm going with the Dal healthcare subscription. Another question that we get often is, what is the difference between the digital assessment library for schools versus the digital assessment library for healthcare? So DAL for school is actually a district-wide solution that is priced completely differently, but it includes the administration for a specific or defined portfolio for individuals within a school board. DAL Healthcare, it does not have a defined portfolio, so you would actually have access to the entire library based on your qualifications. It does not include the administration, but it would include that additional discount, that 7% discount that we talked about, as well as the free shipping a couple times a year. Another question that we have is, do I have do I have to have a license for everyone that is a user on my Q Global DAO Healthcare account? So the answer to that is yes. Your DAO Healthcare account will have a defined number of active users allowed based on the number of licenses you purchase. This will govern those that can administer and generate score reports. And so um, we run into sometimes a scenario where a Q Global account may house different teams. So you might have like one Q Global account, and on there you've got your psychologists, your SLPs, your OTs. And so in that regard, converting an existing Q Global account might be a little bit difficult. It's definitely doable. But what I would say if you're in that scenario and your team is a little bit more complex, please reach out to us. Your regional assessment consultant can definitely take a look and give you some recommendations on what would be the best way to move forward. But in some cases, that might mean that you would have to actually have a new Q Global account for that particular team who wants access to the Dell Healthcare. But hopefully, in most cases, we can just convert your existing account. How do I ensure that I get my Dow healthcare discount when ordering from Pearson Clinical? So currently, the way that it's set up, you do have to call in for your orders through customer support, or alternatively, if you're a larger organization and you use purchase orders, you can always request a quote first from your assessment consultant or from the customer support team, and then you can send that quote over to your purchasing team, who will then arrange to have a purchase order sent to Pearson. And then that will ensure that you get discount applied. Now, in the future, in the very near future, actually, we're planning to have discounts available in our e-commerce website. So later this year. And so that will just mean that rather than calling in, you'll be able to process your order directly online and ensure that that 7% discount is applied. Um, we've gotten the question too of, well, I've just renewed my QNeractive license. Can I still convert to the Dell Healthcare? I think I pretty much answered that earlier. The answer is yes, but please reach out to your local regional assessment consultant to discuss options. Now, I decided to add a few more questions just based on what I've been hearing so far from customers. So I had someone ask me the other day, can I mix and match the core, enhance, and total license within one practice? So I put no here with a little star because for the most part, all the active users on a Dell Healthcare account must be assigned the same license tier. But then we might run into a situation where we can have separate Q Global accounts set up for different teams. And so in that way, it may be possible to sort of mix the core, enhance, and total licenses together. But it's something that we would have to have a conversation with. So please, again, just reach out to us if you're unsure. Does the 7% discount apply to all Pearson clinical orders, including kits and digital assets? Yes, you likely wouldn't be buying digital assets because you'll have access to those already. But if you're buying a kit, you're buying Q Global usage reports, you're buying additional Q Interactive subtests, um, all of these orders will have that 7% discount applied to it. The only exception is your DAO license or your DAO license renewal. When can I add more subtests at the discounted rate? So anytime before your balance runs out, just call our customer support team to order more subtests anytime. And if you're unsure how many subtests you should get, just have that conversation with us. I don't know if in the US we have this, but I know in Canada we released a subtest estimator calculator where you can plug in how many wastes and WISC you're thinking about doing on a monthly basis, and it will predict how many subtests you should purchase. So we can absolutely give you that estimate if you're unsure. Just connect with us anytime. Where can I get further support if I want to get into telepractice? And so we actually have a telepractice resource page. Of course, you can always reach out to your assessment consultant to have that initial discussion. But that telepractice resource page has specific written guidance and policies around being able to administer our tests remotely in a way that wouldn't conflict with the standardized approach of these assessments. So we have product-specific guidelines for telepractice, but also general guidelines around telepractice as a whole. And then in addition to that, of course, check with your local association. They might have specific guides. I've also seen certain institutions provide courses on being able to do telepractice. And so please just look around or have that conversation with us. We'd be happy to provide you some guidance with that. And then finally, the last question I have here is, are newer assessments automatically added to my account when released? So that's an easy one. The answer is yes, as well as new features. And I won't tease you too much, but we have a lot of exciting things coming in 2026. And so if you're subscribed to the Dial Healthcare, any sort of new features or new assessments that we publish will get added on to the Dial Healthcare portfolio. And so you will automatically get access to it without having to make that purchase. Okay, so how to get a quote or how to order. So I've got some handy QR codes here that you can scan if you'd like. Usually the first step is to have a conversation with us to see if the Dial Healthcare would fit your needs. Once you've done that, you may want to get a quote. So you would just confirm how many user licenses you would want and which licenses you would want. We'll send out the quote. If you want to bypass that and go straight to placing your order, you can do so by filling out an order form. And then we will work with you to either convert your existing accounts or create a new account. And so to close, before we jump into Q&A, I just wanted to say that in general, the Dow Healthcare subscription model, it's all about making it easier and more making your practice, I guess, more sustainable, or it gives you access to the full range of Pearson assessment tools. In the end, I think it definitely can save you money. It can definitely scale your practice or help you scale your practice. And so I just want to thank everybody today for joining us. I know there's been a lot of interest in what this offering does and how it works. And so hopefully I've answered a lot of your questions. We will just scan the Q&A box as well to see if there's any additional questions. And if you need to take off, that's fine too. I wish you guys a really great rest of your day. And I'm just going to ask my colleague, Chuck, if you're there, just take a look if there's any additional questions you want us to answer.
No, I've been typing away and I think have covered most everything. So, April or Sam, one of the questions is we're saying that the QR codes that were up on the screen isn't activated, and there's been questions about reaching the consultants for more conversation.
Okay.
So I'm just going to ask April or Sam to maybe grab the contact us, the two URLs for Canada and the US, and maybe drop those in the chat box or
Yep, sure thing.
Q&A box real quick. So look for those two things real quick. Is the current standard license the same as the highest level of DAL access? Yes. That's correct. So the current standard license for Q Interactive in the US is the license that's included in the total license for the DAL healthcare in the US. And then in Canada, the QI Max license, where you get access to everything, is what's included in the total, and the light is what's associated with the enhanced license for Canada. Let's see. Am I correct in thinking that there is no additional cost for Q Global administration? I've been doing telepractice evals for a number of years already on Q Global. So is it correct that this will not change significantly except for access through DAL instead of buying the digital instruments? Yeah, so the big difference, well, there's a couple of big differences are if you go the digital assessment library route, you get access to all of the digital manuals and STEM books, so that's a big difference. You get a discount on all of your Q Global report usages. If you're using QI, you get discount on subtest purchases. You also get some preloaded subtests as well. But from a functionality standpoint, the platforms are still the same. This is just packaging a few benefits together for our DALS healthcare users. Is the current standard license the same as the highest? I answered that. I just tried to scan. So April's posted in the Q&A box now the links for the consultant contacts for the US and Canada. And I don't see any more questions in the box, Sam, so I think we are good.
Perfect. I think the QR code that's on the screen right now, they should work as well. But if not, definitely take a look at the URL posted in the chat. You can always visit our website as well. So in the US, it's pearsonassessment.com. In Canada, it's pearsonclinical.ca. And then if you go to contact us, you will see a button for assessment consultants, and you can find our phone number, email, or book in a time with us to further discuss. And if needed, we can also share direct links to the forms to request a quote or to place an order.
Hey, Sam, just real quick.
Yes.
So there was one question about the use of APIs. I just dropped my email into the answer box for that one. So I want to give that individual just a chance to quickly copy my email before we close off. If you will send me an email with what you were looking for, I'll get you connected with the right individuals to follow up on that question.
Awesome.
Sam, I see you got it, so I think we're good. Sam, not you, Sam on, not you, Sam presenting, but Sam in the question Q&A box. I see you got my email, so Sam presenting. I think we're good with having answered all the questions now.
Awesome. Okay, well, again, thank you everyone for joining us, taking the time out of your day to take a look at this offering. We're really excited about this. Please reach out to us if you require more information, and we'll be in touch. So thanks everyone. Have a great rest of your day.